But I will tell you, our very first concern is with the constituents that we represent. And some people have said that we're simply trying to put obstacles up for the successful implementation of this act. And I can tell you for myself and many others, we're here because our constituents are genuinely concerned and upset about what is going on. And a lot of it begins with the way this bill was passed. When it came to the floor, the most comprehensive change for health care in America that's ever been undertaken, no one could offer one amendment to the bill. And so there are very deep feelings about this still. And many healthcare experts today say that we're going quickly to a two-healthcare system. We're going to have one healthcare system for wealthy Americans, and then everyone else is going to be under the Affordable Care Act. And that is exactly what has happened in other countries that have gone down this path. Now, when this legislation passed, your office was given immense powers and decision-making authority. And we know that many regulations have been written. Could you tell me how many pages of regulations have been written to implement this act?
Sir, I can get you that number. I do not know.
Do you have any idea?
I don't know how many pages.
Do you have a range?
I would like to get you accurate.
I mean, is it 100 pages or would it?
Sir, I will get you information.
So you don't know?
I just told you I don't know.
Now, the President went all over the country talking about how this is going to save money, people are going to have lower premiums. And I can tell you, those of us on the Hill who've been going on the D.C. Health Exchange have discovered that our premiums are certainly much higher than they were. And when we talk to our constituents going on the exchanges, we're discovering that the majority of them, their premiums are much higher. And my understanding, OMB has said that the subsidy will cost the taxpayers over $1 trillion. We've been told that, I'm sorry? Will save. Well, the subsidy will cost the taxpayers $1 trillion because somebody's got to pay for it. And I would also like to ask you a question because of what is perceived as a real inequity in this system, how some people are being favored, other people are not being favored. When you go to the Rotary Club and speak, and people ask you, do you have to go onto the exchange? Does the President have to go into the exchange? Do the political appointees have to go into the exchange? And you say no. Do you think that's fair that the rest of the American people have to go under this exchange, but you and the people in the President's and the executive branch of the government do not have to go on the exchange?
Well, sir, I would tell you that the vast majority of Americans with insurance also will not be on the exchange. 177 million people
but I'm asking about you.
Coverage. It is, as I said to this committee in October, illegal for me to go onto the exchange. I misspoke slightly because the reason it is illegal for me, which I knew, is I'm an old lady. I'm Medicare eligible. It is illegal for a company to sell me a policy because
you don't have to go on the Medicare, though. You don't have to go on the Medicare if you're working
I am not
somewhere.
allowed to be sold a policy in the private market.
But look, all right,
over 65.
thank you for your comments, but the bottom line is the executive branch of the government does not have to go on the exchange. Everyone else does have to go on the exchange. Now, in addition to the $1 trillion that the taxpayers are going to pick up on the subsidy, they're going to pick up another $710 billion because the President agreed that the federal government would pay more of the state Medicaid cost. And then
sir, that's fully paid for in the health care law, and in fact, the CBO has estimated that it reduces the deficit.
It's fully paid for by the taxpayer dollars, by general fund dollars.
Unlike Medicare Part D, this bill was paid for.
And then let me just say this. The President said that everyone's premiums would decrease. The President said people would be able to keep their plan. The President said they would be able to keep their doctor. It's turning out that that is simply not the case. And so there is a lot of frustration, and we are upset about it. and my time's expired, so thank you.
Thank you, gentlemen. Time's expired. Ms. Schakowsky, you're recognized next for 5 minutes.